Thank you all so much for joining us. And we're streaming on Facebook Live this afternoon at the March of Dimes. My name is Stacy Stewart. I'm the president and CEO of the March of Dimes, and it's really, really great to see you all this afternoon and this morning, depending on where you are. This is the fifth in the series of webinars we've been having every week now, Healthy Moms and Strong Babies during the COVID-19 pandemic. And today we're going to have a really exciting conversation with some amazing panelists who are just chock full of information and expertise. And I'm so excited to be with all of them this afternoon. Today we're going to be talking about bringing your NICU graduate home during a pandemic. We know that about 400,000 babies every year are born prematurely. The vast majority of them end up in a NICU for some period of time, sometimes for a few days, sometimes for a few weeks, sometimes for many, many months. And the idea of not only delivering a baby in the midst of a pandemic, but having a very vulnerable NICU baby who's ready to leave the NICU and come home and be in the world, even if we're quarantined at home, just has got to feel really scary to so many families and so many women and moms and dads all over. And we thought it'd be very important to begin to have a conversation for those of you that are NICU moms or NICU dads, for those of you that are healthcare providers and are looking for additional help of how others are managing through this crisis. We want that conversation today to be about what we can do to provide as much information to make the stress and the anxiety and the whole process of managing through with a vulnerable baby in the midst of a pandemic as easy as possible. One of the things that we know, and we've had many of these conversations over a period of weeks now, we know that we know some things about what's happening with moms and babies through this pandemic, but there's a lot that we don't know. There's a lot that we still don't understand. This is a novel virus, so we still are learning as we go, and I think we'll be talking about that today. So for example, we don't know if there is transmission, what we call vertical transmission from the mother to a fetus of COVID-19. We don't know, for example, how vulnerable and susceptible a newborn baby is to contracting the virus. We do and have seen reports of babies contracting the virus shortly after birth. Again, not sure whether it happened right after birth or if it happened before birth. But one of the things that is for sure at the March Times, these are the issues we're going to be working on for now. We're starting now and for many months to come to really understand the full impact of COVID-19 on moms and babies, and hopefully learning from our experience now to apply in the future. But today, one of the things that we can't avoid and we cannot delay, if a woman is pregnant today, if her baby is ending up in the NICU, she needs answers now. She needs help right now. There's no delaying pregnancy. There's no delaying childbirth. And so our job right now and today is to make sure that we bring as much of that information, as much of that resource to many of you all and to your friends and family members as possible. So please be sure to share this information with others. This video will live on the March Times Facebook page, so you can continue to share it with your friends and family members and others even after this. And certainly we want to remind everybody that today you're going to hear from the panelists, but the really important part of this is that you'll get a chance to add comments, add questions. If we touch on topics you need for more information, do not hesitate to add a comment or question in the comments section on Facebook. We will be getting those questions. We can address those questions, ask those questions live, get the panelists to respond. And we also have people that are on the Facebook chat as well who can answer your questions and send you links to information and things like that. So again, thanks for joining and excited to get started. I'm going to start with introducing our panelists. And the first I'm going to introduce is Dr. Terry Major Kincaid. Dr. Terry, I'm going to call her Terry or Dr. Terry or Dr. Boo because that's what she often gets referred to as. Dr. Terry is a neonatologist, and she's also the chair of the March Times Steering Committee for African American Outreach for the state of Texas and has been in that position for 10 years. But she's a wonderful neonatologist with a wealth of information to share. So Dr. Terry, thanks for joining us today. Christina Lloyd is a master's prepared NICU nurse and program coordinator for one of the March Times NICU family support programs. So a lot of people may not know that we have dozens of support staff in NICUs, in many hospitals around the country, specifically to provide hands-on support to families when they're in the NICU. This can be probably the most stressful situation, as I know you'll hear from one of our panelists, that any parent could ever imagine. Landing in a NICU with a newborn baby, and worrying every single minute of the day about the health of the baby and how you'll ever make it through. So our NICU family support staff do an amazing job to try to be there for those families and be there for those moms and dads. So we have Christina on as well. We have Leanne Hoy, who is a nurse and a neonatal nurse navigator. That's a mouthful at the Center for Maternal and Fetal Health. And at Rocky Mountain Hospital for Children. And we're certainly grateful, Leanne, for you joining and for being such a great partner also with the March of Dimes. And then certainly last but not least, we have a wonderful, wonderful mom and international TV personality who has her own NICU story to tell, and at least a couple times. Adriana Costa is known by a lot of us. She's a very familiar face from CNN headline news. She's been seen on glamorous red carpets with shows like Extra and Access Hollywood. And she, as I mentioned, is a mother of a NICU graduate, and she's a very frequent March of Dimes supporter. We're really grateful for all of you all being on today. So I'm going to get started and just moderate our discussion. I'm going to just introduce each one of you all with a couple questions, and then we can get into much more of a dialogue. So Dr. Terry, I'd like to turn it to you. Obviously, as a neonatologist with years of experience, you're probably experiencing things that you've probably never seen in your time practicing medicine. Talk to us a little bit about what you're seeing in terms of how challenging it is to treat NICU babies now during this COVID-19 pandemic. What are you seeing as some of the risks to some of these NICU babies? And you might just have to come off mute, Dr. Terry.
Okay, I'm off mute. Hey, Facebook. So, I'm just sitting here smiling as I'm listening to Stacy. I just want to say to the moms and dads out there, these are unprecedented times for you and for us. Let me just echo. It's unprecedented for you and for us. So we're learning something new every day, changing protocols every day, trying to do something different every day to keep you safe, your baby safe, but us safe too, as well as our families. So that's the first thing. I think we all are going to look back on 2020 and be like, wow. So in terms of COVID-19, specifically in caring for babies, I want to say to the parents who are worried about COVID-19 infections in their babies, I'm sure you've seen a couple of case reports of babies who actually have died from COVID-19. So we've ramped up the way we screen babies as well as the way we screen moms. So moms who come in who are persons of interest, they answer the questions first by the OB. They automatically get tests if they meet those criteria. If they're positive, they cannot come into the NICU. So that's a big change for us, not having moms in the NICU and possibly not having dads either if they're persons of interest. Babies that are of risk are separated from the other babies in the NICU. They may be in an isolation room, or if they can't be in an isolation room, they're at least 6 feet away from the other groups that are cohorted. Everyone is wearing a mask now. We weren't doing that before. Everyone is getting their temperature checked. It may be once a day when you enter the hospital or several times, depending on your NICU. Everyone is keeping their cell phone in a Ziploc bag. And so just the whole way we triage and support the maternal infant bond from the beginning to the end has changed. In terms of looking to see, is this baby sick? Like, does this baby have COVID? I don't think moms and dads realize how hard it is for us to assess that in the beginning while we're waiting for tests, because a baby with a COVID infection looks pretty much like a baby with any other respiratory infection in the NICU. So are they having trouble breathing? Do they need more oxygen? Are they having more episodes where they're not breathing, like apnea? So all of you who've been in the NICU know what it is to have apnea. You know what it is to have breathing problems. You watched your baby on oxygen. So now we have another layer. We have to add something else to our differential. Even bigger kids that we're seeing, we have to say, oh my goodness, I can't just look for flu anymore. I can't just look for RSV. I gotta look for COVID too. So our differential is changing. So it's unprecedented times for us as well. But for us, the biggest issue is just the mechanics of admitting you to the NICU, allowing you access to your own child, and then how we allow you to leave the NICU. So that whole thing has changed just in the way we triage. But I will say a lot of us in the NICU already have cell phones and Ziploc bags. The adult
So that
started doing that. NICU moms and dads were already doing that because we know the cell phone is a big risk for bacteria and infection.
And let me ask a question. So once you're in the NICU and you're ready to go home, Dr. Terry, what are you talking to your patients about? What are you talking to families about that they need to do? What are the protocols that you want them to follow? And I know you have a telemedicine practice as well. So what kind of support are you giving parents as they transition home with their NICU baby? NICU
right.
graduate.
So the first thing I want to remind the NICU parents, you guys are, the NICU moms and dads could answer this question. So you guys already know your baby is medically fragile. We could, even pre-COVID, we scare you to death when you first take your baby home anyway. If I have somebody that takes their baby home in February, I'm like, do not go outside until after Easter. Okay, that's it. That we're done. So this was pre-COVID. So you have a medically fragile baby, medically, you're worried about COVID, but we're worried about all the other stuff too. Flu, RSV, making sure your baby keeps eating, making sure your baby keeps gaining weight. So the three main things that I say to families when they first go home in terms of discharge are: one, we were already social distancing. You're happy to take your baby home, but this is a preemie. So the immune system is still fragile. You still want to keep the baby home and the immediate family, just having access to the people who really need to be around the baby. I tell everybody, just take a picture of your baby, put the picture on the door. Hey, this is what the baby looks like. We'll see you guys in August, even pre-COVID, because you don't want to come back to the hospital, right? The second thing, make sure you keep your follow-up appointments. And this is kind of controversial during the times of COVID. In pediatrics, we're actually seeing a significant decrease in the well visits, and we're seeing a decrease in the number of scheduled immunizations because parents are worried about their babies getting COVID. Moms and dads, you're doing the right thing. You're staying inside. You don't want your baby around others. But if you have a preemie, that first follow-up appointment, you guys, is very important. The three most common reasons a NICU baby comes back to the hospital are: one, poor feeding. The baby was eating well in the NICU, but now they're not eating. Two, a blue spell. Somebody fed the baby choked and turned blue. Every mom and dad out there has seen their baby do that in the hospital, but you guys are pros now. And then three, a significant infection, like a respiratory infection. So, and I want to say something about temperature. All the adults were focused on a higher temperature, like fever. But in a preemie, I want the mom and dads to remember you guys, a low temperature in a baby, even if you don't have a preemie, a low temperature in any baby can be a sign of a significant infection. In fact, if I'm called to the ER and they tell me that the baby's temperature is low, I'm actually more concerned about that baby than I am about somebody whose temperature is high. So that's a very ominous sign. So when you're getting ready to go home, we're going to keep distancing. Obviously, we want baby and mom to be together. Even if mom is positive and she's trying to pump breast milk and the baby's in a separate room for the mom, she's doing the breast milk hygiene and stuff. We want to keep distancing from other family members. We want to try to keep those appointments. So if you can't, if your pediatrician is offering telemedicine just for a weight check or how's the baby eating, fine. But if you're due for shots, or even if the siblings are, call and see if they're doing the drive-through vaccines, because measles is making a resurgence back in the US, and a lot of people are skipping the 12 to 15 month shots for those babies. For your preemie though, they still need their 2, 4, and 6 month shots, but you can coordinate with your pediatrician to see how you can handle that. So in my practice, I mostly address developmental and nutrition. But moms and dads, I know you're scared, but do not skip that first follow-up appointment when you leave the NICU. Your pediatrician needs to see the baby in their healthy state. Not 4 weeks from now, different than the way I sent you home.
That's good. That is really helpful. And we'll come back to you, Dr. Terry. Thank you. That was really awesome. Thank you. Christine, I want to turn to you. You know, you're in NICUs every day. You're a NICU nurse. You're one of our NICU family support coordinators. What are some of the questions that NICU moms and dads are asking you right now? What's the help that they really need? And what are some of the answers that you're giving them right now for their most critical questions?
Yeah, great question. I mean, I think overall, I think we kind of alluded to this in the beginning, is just that extra need of support right now in general. You mentioned a NICU experience can be so overwhelming with the amount of information a family has to learn, all this whole new language to them that they've never really learned before. Not to mention that oftentimes separation of any kind from your baby, whether it has to do with COVID or simply you're discharged and your baby is not, they have to stay behind, can become an extremely traumatic event in a family's history in their life. And there's a whole body of literature out there now how traumatic this experience can be for a family. And now we're adding to that trauma with the COVID and the elements of perhaps if there's employment issues or, I'm just scared to take my baby to the pediatrician afterwards, or I have a family member who is sick and now I'm going to take this baby home. So we're just helping them navigate individually through every family's own questions right now.
So where can families really turn? I mean, obviously, if you're in the hospital, they can look to you for help in addition to the doctors and nurses. But where else can, if I've just brought my NICU baby home and I've got questions like this, and obviously I'm going to reach out to my pediatrician and things like that, but where else can I go for help and some assistance on getting some of my questions answered?
That's what I was going to say. Start with your pediatrician. If you're still in the hospital, certainly, hopefully you have a case manager or social worker or navigator that can help you through some of these questions. If you are at home and are looking more towards resources online, certainly try to stick with those reputable sources like the CDC. Hopefully maybe in the chat box or something we can get the zoomed in links off the CDC specific for moms and babies. The American Academy of Pediatrics has their provider site, but they also have a site just for families called healthychildren.org, and they have a whole COVID section. And then certainly I always refer families to both the March of Dimes website and then the free app that March of Dimes provides in English and in Spanish, the My NICU Baby app. Wealth of information, both in English and in Spanish, both in the written word, but also in videos. I really recommend downloading that and getting all of that in real time. We also have a number of online forums like our community March of Dimes Facebook group and shareyourstory.org if you're looking for that extra level of emotional support and connection with other families.
And Share Your Story is great because you get to, if you want information even beyond what your doctor is sharing, if you want to hear other experiences of other moms, that's a great place to go. Say, hey, I'm experiencing this. Who else knows this? It's a great way to crowdsource information and just connect with other moms who might be going through similar
You will quickly find you are not alone.
You're not alone. That's the most important thing. And I would just underscore the My NICU Baby app has been updated with a lot of information. The March Dimes My NICU Baby app, it's available on Apple, it's available on Google. And also we just rolled out a new web series, an online series to help families with NICU babies, a whole family online education series. I'm sure in the chat box, we're going to put more information about that as well. So Christina, thanks. We'll come back to you as well.
Yep.
Hey, Leanne, thanks for joining. And you're also a NICU navigator in the hospital, and you work with NICU families every day. Tell us about what the resources are that are available for families when they go home. What should families be doing to prepare for that time to go home? I mean, there may be formula needs, in-home nursing needs. Talk about how families are managing through this, especially when you've got maybe somebody who needs to come in the home and how they may be extra stressful about having someone enter the home that may not be a part of the family.
Yeah, I would say the first thing I would say is that when you're in the NICU, really getting to know your neonatologist and the people around you. So you start conversations early on before your baby starts to go home, like what would be a secondary formula if I can't get this formula? Is my baby growing well now? Can I start buying this at home so I can start stocking up? How do I keep my breast milk supply going? So using your lactation consultants while you're in the NICU, I think is really valuable. So it kind of preloads you for home. So you're not trying to problem solve all this 2 days before you're going home. even thinking ahead and just having that conversation with your neonatologist. Is my baby growing well on this formula, you know, and is this a potential for me to go home on it? I think is really good. Once they're home, I feel like, you know, it's always a choice to have. You always have choice, and that's really important to know that if you choose to have nursing come in, the value of that is that they can track the weight, they can track a lot of the growth parameters that the pediatrician typically does. And if you're just doing a drive-by with the pediatrician, you know, it's really hard to kind of get an overall feel for your baby. So it does give you someone who is coming into your home to do some of those things, which is great support for the family. You don't feel like you have to go out, but on the other side of that, you're having a stranger come in. And, you know, the number one thing I would say is that before you have a caregiver come in, really have a conversation with them. You know, can they call you the day before, and let's go over what are the things that they're doing to help protect themselves and your family. When was the last time they washed their hand? Do they change masks between homes? You know, do they change their glove between homes? Do they wash their hands, then put their gloves on when they're at your house? Do they use paper towels? You know, like all those things really help to list it out, so together you can help come up with the best plan for your family. And the other thing I would highly recommend is if you could have consistent caregiver. If you have a nurse coming in to your home, can it be a consistent person? So you feel safe. If it's a different person every time, that is more hard. It's harder to really build that safety that you really want for your family and new baby at home. So those are the things I would recommend.
That's good. And talk a little bit about, I mean, in addition to nursing help, there could be other kinds of things that families need at home: monitors, oxygen, other kinds of resources. You know, this is also a very difficult time economically. A lot of people have lost their jobs, may not have access to insurance anymore. What are the resources out there? If someone needs help, you know, with more things in the home to help take care of the baby, where can they turn for help? How do they navigate that?
Yeah, you know, I mean, in Colorado here, I mean, we have a lot of different programs, and I think every state, if you go to your county and your county website at home, then it usually lists, and then put in premature baby or put baby into the search box, you will come up with resources. So there are a lot of programs that people don't know about. For instance, in Colorado, our handicapped children's program, it is a free service for people to for a nurse to come to their home, or they can also have a call from them. So, and we have at our hospital, we really try to communicate with these community programs, because we know that the transition is away from the NICU, and you know, parents want to go back to the NICU, and we get that, but at a certain point we are not going to know your baby as well. I mean, to have your resources around your community is really important. So,
and a lot of hospitals have access to a lot of information, a lot of resources of how to help families too. So checking in with the hospital, maybe a social worker at the hospital can often be helpful, and that's certainly been our experience, right?
Definitely.
Good. Hey, Adriana, thanks so much, Leanne. Adriana, thanks for joining, and thanks for being here. Thanks for being such a great supporter of the March of Dimes to you, and really to all of you. You know, you've got a very compelling story, and I know it really in many ways sort of changed your life, that you are a mom of 2 NICU babies, that you spent several weeks in the NICU, your son and daughter, and you know how stressful it can be even during normal times.
Oh yeah.
Talk about that, but also talk about what you would want parents to know who are now bringing their NICU babies home, NICU graduates home, to help them deal with that stress, or what advice you'd have for them based on your own experience of how they can manage through this very tough time.
Yeah, it is such a traumatic experience. I was just, because we're trying to raise money right now for the March for Babies, and we're the ambassador family this year, which I'm so grateful about and so honored. And I love March of Dimes. Love March of Dimes. And I'm actually soaking in all this information and wisdom also from the doctors and nurses here today. And one piece of advice that I would like to give the moms out there is to use the support you have at home. So if that means you're delegating something to your husband or the father or your partner or whomever it is, do that. Because as much as we need to take care of the babies, we need to take care of us as moms as well. We have such a heavy load on us from trying to get the babies well fed, nursing all day, pumping. And I think it is, I don't know that the statistic is totally 100% true, but you can let me know, docs. I think it's like 1 in 3 mothers are more likely to suffer from postpartum depression if you're a NICU parent. That was my experience. I had terrible postpartum with both my babies to the point where I didn't feel equipped to be a mother. I thought, right now, let me get into a car accident and somebody go haul me off to the hospital because I need to be taken care of. All I was doing is giving, and I wasn't rested enough, and I wasn't getting out. And and this is why I defer to Dr. Terry on this. I have a question actually as well. But for us, before the pandemic, we were taking walks. And one of my nurses had said to me, there's nothing that'll help your child bloom like getting them out there in the fresh air. The irony right now is that as fresh as the air is and as nice as it is in many cities and counties, you can't get out there without a mask on. So Doc, I would ask you, is it okay to bring your baby out in the fresh air right now?
Great question, Terry. And just unmute yourself, Terry.
I keep muting myself so you guys won't hear me going, yay, yay, yay. So, great question, Adriana. So, of course, yes, you guys can go outside in the fresh air. You still should keep the social distancing depending on your state. Like, they've opened up the parks. They've asked people to keep the social distancing. I still say take your baby out in the stroller and keep them covered, because you may be out there minding your own business, but somebody's going to walk up and go, hey, coochie coo, is that a baby? And then you're going to be in a fight. So I would just say, yes, you go. I think, the weather here in Dallas is great. It's been great all week. So definitely, I think fresh air is good for the moms as well as the babies. We're all getting a little stir crazy. So I think that's totally fine. My bigger concern is crowds. Like, a lot of people want to take their baby to church for christening right after they leave the NICU. I would delay that. And I would add to Adriana's point about, I'm so glad she mentioned the 1 in 3 postpartum depression, and that Christina mentioned PTSD, because a lot of NICU moms also have symptoms of post-traumatic stress. And when people are saying they're stressed, it actually can be depression being masked under their stress. So definitely the mental health support and self-care is important.
So and this is for any one of you all, and we'll just kind of jump into it. And so, Adriana, talk a little bit more about what were some of the signs that you felt you knew you were having postpartum depression, and because it doesn't show up the same way in every woman. And some women experience or have a feeling they have no idea it's postpartum depression. They don't know they're suffering from PTSD. So what are the warning signs if a woman's not feeling herself? What should she be looking out for?
Yeah, and that's the truth. Like, I think it sort of manifests differently for everybody. I was already predisposed to having slight anxiety, but it showed up in me about a month after I came home. So I thought I was doing it all. I was I got this together. I was able to change a diaper. I learned so much from the NICU nurses and doctors, but about a month into it, it hit me, and how it manifests in my brain is I disassociate. So I feel like I'm in a video game. I can't take it all in. And then it got to the point where getting out of bed was really hard. And I was crying uncontrollably at anything. And of course, that's just your hormones working as well. So for you moms and dads at home, it's unbelievable to think that not only are you going through what could be one of the most traumatic experiences in your life, not only have you had a baby, but your baby came early, potentially with health struggles. And on top of it, you're dealing with a pandemic, which is really scary and unsettling. For me, any form of exercise, be it a walk around your block, but again, and social distancing, but keeping your baby covered. Yoga helps a tremendous amount. If you can sweat a little bit, if you could get up and just take a shower and have the hot water run on you. Nap when the baby naps. And I used to laugh at my mom for saying that, because I was like, but I'm working now. I can't nap. Who's napping? If you can just even lay down, take the time for yourself to rest, because so much of it is just exhaustion. Your body's not catching up.
Yeah.
Those are the things, and make sure you're eating healthy. It's not time to worry about losing weight or dieting. It's time about making sure that you're nourishing your body. So those are sort of some of the tips that worked for me.
Those are all the things we need to build strong immune systems too, so we can fight back against this pandemic, all of us as well. I'm going to ask a couple of questions, and then I know we're getting some questions on Facebook too, and I know folks are answering, but let's go back to the NICU or even after the NICU. So what is the protocol in the hospital if a mom has COVID-19 and she delivers a baby prematurely? What is going on in the hospital? And I'll turn to you, Terry, to start, but Leanne or Christina, you guys chime in too. What is going on to protect the mom and the baby? Is there separation going on? What's going on with breastfeeding and how is that working? Walk us through that. And then what if a family member gets COVID-19 when they go home with the baby? How do you navigate through all that?
Oh gosh.
That's a lot.
So I'll take the first half. So it's been interesting because we got new protocols every week from ACOG, from AAP, from the CDC. You know, you do something Monday and come back Tuesday like, what? I'm doing what? We're doing what? We're not going in. We are going in. So it's just been very, very interesting. So now you started by saying if the mom actually has COVID. So if the mom actually has COVID or is a person of interest, you know, the healthcare providers are all immediately in full PPE now. We weren't initially doing that in full PPE until we actually had positive tests. Now we're doing it for persons of interest. The baby is immediately separated from the mom. And that's been very hard. It's been hard for everybody, but I think particularly in the pediatric community, it's just so counterintuitive to separate a baby from every time I have to tell a mom, okay, the baby is coming with us and dad may not be able to come to the NICU either. I mean, it's tough. So some hospitals are smaller. They can't actually do the separation. So if they can't do the separation, then there's supposed to be a barrier in the room keeping the mom 6 feet away from the baby. But if the mom is positive, you're supposed to have immediate separation. Those babies either go to the NICU or overflow nursery. The baby gets 2 tests, one at 24 and 48 hours, and you wait to see if those tests are negative or positive. If the baby's asymptomatic, the baby can still go home with a positive test. If they're asymptomatic, you just have to have a designated caregiver who does not currently have symptoms. In terms of breastfeeding, even if any positive mom cannot come into the NICU anymore, but we are still encouraging breastfeeding, breast hygiene, using breast hygiene with your pump when you're actually pumping the breast milk, making sure you're cleaning the pump appropriately, you know, using soap and water, drying it appropriately. We used to have communal areas where the moms could pump together. We don't have that anymore in the time of COVID. We don't have any group rooms in the group mingling in the waiting room or in the breast pumping room. So yes, immediate separation. When the tests come back, the baby usually can be discharged with the caregiver, maybe a grandparent or the dad. If mom's negative, then maybe they could go with mom. If the mom acquires it in the community, she's not going to pass those questions. We have screening questions now. Are you a person, have you had a positive COVID test? Do you have a cough? Do you have a fever? Do you have URI symptoms? If any of those are positive, the mom is not going to be able to come back anyway. If she is positive, but her symptoms are better, the earliest she can come back to the NICU is she has to have 2 negative tests, and one of those tests has to be at least 7 days from the onset of symptoms, and she has to be 3 days without symptoms. So that has all evolved over this way. So yes, immediate separation, and yes, it breaks our heart. And sometimes neither mom or dad has really, like if the mom has to have a C-section, because everything happened so fast, she didn't even see the baby. And if dad didn't get there in time, guess what? He didn't either. So that has been really, really hard. The other thing I'll say about separation, Stacey, is depending on the unit, to the moms and dads, especially those moms who are on bed rest watching this, who think you may be having a baby that may go to the NICU. I specifically want to talk to you. Find out how the visitation has changed since you were admitted to the hospital. Some people have been on bed rest, since January, before all of this happened. They're hoping to get to term. Some NICUs are only allowing visitation once a day. Once a day. One person once a day. Others, you can come multiple times, just one person. And some units is 2 persons. And it usually has to do with, is it an open unit? So obviously you're going to be a little more concerned with multiple people, or if you have private rooms. So my friends who work in NICUs with private rooms, they're still allowing 2 parents to come because everybody has a private room. But I found out yesterday that some units is once a day. Once a day.
Wow,
so,
that's tough. And Christina or Leanne, talk about breastfeeding. What are you talking to moms about today in the midst of the pandemic about breastfeeding? There are a lot of moms who continue to ask, is it safe to breastfeed? What are you all telling moms, and what are the precautions they should be taking, especially with NICU babies, especially even when they're at home?
Right, right. Well, what we're going on where the information we have today, right, is that breastfeeding, and this is alluding to what Dr. Terry said, things are changing daily. But a consistent message that we really have gotten from the World Health Organization and the CDC is that providing breast milk to your baby is safe and is in fact the best thing to do. So starting with that really good hand hygiene, right? 20 seconds of good hand washing and very clean, taking a hot soapy brush and getting all those pump supplies well cleaned, sterilize it at least once a day. So when you're starting, and then also the added of what we're calling breast hygiene now, wiping down the breast as well to make sure that you've cleaned the breast. And then once that is done and you can pump milk for your baby, and I'm sorry, I'm coming from the perspective of if the mom is COVID positive, then you would want a well caregiver then to feed the baby. If the mom is COVID negative, she may breastfeed the baby. And then we also have the donor milk programs in our hospitals, and we are still continuing to encourage moms to not be afraid of the donor milk at this point in time, that this milk is well screened. It is also pasteurized, just like any milk that pasteurization, the similar process that we drink in the grocery stores. So to not be afraid of that as well.
That's great. Very helpful. We do have a couple of questions from Facebook, and I'll just throw it out to whoever wants to answer. So there's one question, when will it be safe for a grandparent to hold a newborn? And I would say, let's put this in the context of a NICU graduate. This is coming from a woman who is going to be a grandma in June. And she does want the mom and the baby to be safe. Of course she does. But what's your advice to the new grandmoms that are watching us today?
So my first question actually is, I'm more worried about the grandmom than I am actually about the baby. So hopefully by June we will be toward the end of this. But really, I don't know how old this grandmother is, but those who are in the older age group, certainly in Texas, those with the highest morbidity are those 75 to 80. So those grandparents, if you're going to a home where your son or daughter just had a baby and then they have other kids and there are other people in the house, it's actually a higher risk to the grandparent than the baby. I think a grandmother can probably hold a baby. I mean, yeah, she can hold her baby, but I'm more worried about her risk because I mean, if you look on Facebook, there's so many pictures of people driving by their parents' houses and just waving through the windows. So I would say to the grandmother, congratulations on your grandbaby here to be soon in June. And hopefully by then everything will be a little more relaxed. I don't know what state you're in, but if depending on what the testing, we're testing more. So we're finding more cases. Texas, we have 28% more cases last week. So I would see, what the baseline rate is in your state, follow the testing rate, because even if things are relaxing, if you live in an epicenter, it may be better for you to stay, because many people are going to be asymptomatic and be well or only have a mild illness, but that may not be the same.
So in many cases, drive-by visits may be what works.
Yes, drive-by.
If there's testing available, I'm hearing you saying if you can get tested and know that you're COVID negative before you make that visit, great.
Yes.
You're wearing a mask, right? It sounds like
Yes.
that is all these things that we're being advised to do. But
yes,
of course, it's going to be everyone's decision. Every family has to make their own decision, but they should certainly know what precautions to take, I think is what you're saying, right?
Right, right.
We have some more questions. When is the best time to go for a well visit, and can special arrangements be made? So who would like to take that one? So if you've got a NICU graduate and you've got to go through, and you touched on this a little bit, Dr. Terry, but the special arrangements in terms of, the virtual visits, telemedicine, can any of you all talk a little bit about what's available to many families so they can make those well visits?
So a lot of PDs are reserving visits for preemies for the first visit of the day. You can call your pediatrician. I want the first visit of the day. I have a baby home on oxygen and a monitor. Pediatricians are very accommodating. They're doing drive-through. So if the pediatrician was identified before discharge from the NICU, I would follow up to see how you could arrange a special visit for your baby. Normally for a preemie, we want them to be seen within a week of discharge, especially if they go home on equipment. A healthy term baby, you usually can wait 2 weeks, but for a preemie, we really like them to be seen within a week of discharge.
And Leanne, I know you mentioned to me earlier that a lot of families, and when they end up in the NICU, haven't even gotten to know their pediatrician. So talk a little bit about the bridge you're creating, and what is it that you're doing to help make sure that NICU families do create a connection with their pediatrician and then know what the next steps are once they are able to follow up with the pediatrician.
Yeah, I think that the important, and this is a tricky part with COVID, is that, you have the fear of taking your baby in, but yet you're still wanting to establish that relationship with your pediatrician. And really the care goes from our neonatologist to the pediatrician, but really you're the expert. The parent is really the expert of their baby. And that's why we've always encouraged families to be such a large part of NICUs. And I would say, the recommendations I would say is call ahead. I mean, I really cannot say that enough. A lot of parents wait till, the week of discharge, and everybody's anxiety is so high, but really, if ask your friends and get 2 names of pediatricians, call their office, talk to the person that is answering the phone, get that gut feel that is this someone I can ask to talk to my pediatrician? What will they do? Who's the nurse there? Could I talk to one of their nurses, one of their hotline people? So if I have a question at midnight and I don't know who to call, then, really scouting out that pediatrician is really good. I think the other thing is that, pediatricians, this is all new for them too. And so, if they may not have the answer, and if you're within a couple weeks of leaving the NICU, I mean, you can call back to your NICU. I don't know a NICU that would not turn that call away. They are there 24/7, and, just lean into that system as you need to, because nothing is worse than to have a family worry at home. And, sometimes it's waking up dad. If you've gotten up in the middle of the night, or your partner, waking up your partner and just saying, call the NICU for this question, or bring up grandma. Grandma always wants to do things, really help, use the people around you to make some difficult calls. But we're encouraging families to first call their pediatrician, and then if they continue to have a question, they can email me, they can call back to the NICU, and we can get a dietitian on the line. I can get our psychologist on the line. There's a lot of resources within our system and most NICU systems that you can call on.
So the NICUs are really providing a lot of care, even for those families who've gone home. You're still serving as a resource, which is really nice. Mm-hmm. And I also think that, we've heard from pediatricians, even in our webinar last week, who said, mostly all the pediatricians that he knows of, and this came from Dr. Sesh Cole, who's on our National Board of Trustees, said, most pediatricians really change their practices. They're not allowing long waits in a waiting room. You can set an appointment and call in advance, and as soon as the doctor's ready to see you, you can walk right in and then leave immediately after. So you're not exposing you and the baby are not being exposed to a lot of people. And I think that's all been very helpful. So you can also, I think, doing what you said, Leanne, calling in advance, making sure you understand what the protocols and procedures are, so you feel comfortable and feel safe. But it's nice to know that a lot of doctors and their practices are have adjusted to the reality of the situation. Yeah. We have another question on Facebook about Kangaroo Care. And Christine, I don't know if you want to pick this up and then anyone else can chime in. How do you feel about Kangaroo Care now? We're seeing some hospitals restricted in the NICU. So talk to us a little bit about that.
Yeah, quite honestly, that breaks my heart. We've come so far, and so in practicing the emotional and psychological benefits of skin to skin, but really the science of skin to skin as a physical benefit to both baby and mommy. So it does break my heart to kind of see this, but it is happening, and I see it restricted. so far where I am in Virginia, again, in accordance with our local epidemiology and our local policies and our local, what's going on in my hospital, we're still, for COVID negative mothers, we're still very much encouraging it as an incredible way to bond, get close to your baby, have that connection, to mitigate those symptoms of postpartum depression and stress and anxiety. Very helpful in doing that. But if you have a COVID positive mother, just as we're doing with the risk in actually doing breastfeeding and needing a mask, I mean, we have to take all of those things into consideration. I know
the restrictions are really happening when the mom is COVID positive. Is that
from what I see in my hospital? Dr. Terry works in a very different institution. I don't know if you're seeing something different. In my, we come from a primarily private room. NICU, so we are able to social distance very easily. Dr. Terry, are you seeing something different in Texas? And
yeah, it's very variable. So in most of our large units, initially, if the moms are COVID negative, we were allowing everybody to still Kangaroo Care.
Mm-hmm.
But as we find out more and more information, we're having to place more and more limitations on the access. So I would say half the hospitals I work in are still allowing Kangaroo Care and 2 parents.
Yeah.
The other half is not. In one hospital I work in, you can only come once a day.
Mm-hmm.
So one nice thing is the group I'm in is actually doing a national survey now for people to actually report what are you doing in terms of your NICU visitation and what have we learned from that. So we'll be able to get a little more data about that. But I'm team Kangaroo Care.
Yeah.
But I was also team 2 parents in the NICU. So I'm like, okay, I'm on the team by myself. So.
Can I say just,
no, we're all on the team with you, trust
Yeah.
me. Adriana, I have a question for you because there's another question that came from Facebook. And this question is for you too. How did you manage family expectations for seeing a NICU baby? I mean, I know you probably had a lot of family members who wanted to come immediately as soon as you got home. How did you manage through that? And
I even remember, like, my sister-in-law wanted to see the baby, I think, in the NICU. And we were like, wait, because I was so nervous and terrified just from the experience we had been through. So I think in a weird way, maybe the silver lining of COVID is that you have one extra layer of protection because nobody wants to get sick. And honestly, defer to the nurses and doctors. Like, maybe you can use them as your allies.
Blame it on them, right?
Sorry, guys. Sorry, Dr. Terry. No, but the truth is everybody needs to stay safe in this. So what could be great is starting a photo stream on your cell phone and sending in all the pictures and give your family access so they can be part of that. Or if you use social media, maybe having a private account and allowing your families in on that. But especially right now, it is so important to keep everyone healthy because in the long run, that's going to make the difference. And then you can have the party and bring everybody over. So let's just get to the finish line.
Yeah. And we have FaceTime and you can do a Zoom call with your NICU graduate. How about that?
mm-hmm.
Can I say something about seeing the babies
Yeah,
for the
please.
people who may be getting depressed about the separation?
Please.
You mentioned that a lot of pediatricians have changed the way they practice, and a lot of NICUs also have stepped up. So half the NICUs are working actually already have webcams, but other NICUs who did not have webcams have developed apps that are just based for the NICU where the parents can get texts about, did the baby gain weight? Your baby, your baby pooped today. Parents love to hear that. Your baby finished a bottle today, because they may only be able to come once a day. And a lot of times when I'm calling, it's bad news. But if you actually get some good news, hey, your baby gained weight today, your baby got out of the incubator, that helps the parents stay connected because they already can't see the baby as much as they would like, and they may not even be able to kangaroo. So it's been fascinating to me to see how different NICUs have tried to, still create a bonding for the parent
really
and the
awesome.
child.
We have another question about at what point do NICU grads outgrow being extremely fragile? So, Dr. Terry, that may be for you too, but Christina or Leanne, if you guys want to chime in, at what point do NICU grads outgrow being extremely fragile? And I guess everyone's pretty fragile in the midst of a pandemic, so it's a little hard to know.
If the person typed that knows me, they probably said Dr. Terry's going to say never. But what I would say to the specific question is a lot of times it's seasonal. right? So if you go home during the winter, we're very worried about RSV. If you go home with oxygen or a monitor, it depends on how small your baby was and how much equipment they required and how rapidly they regain their birth weight. So we normally are concerned really for the first three, I would say the first 3 to 5 months after discharge, depending on how premature the baby is or was, and if they get off their equipment. So if you have a bigger preemie, like if you had a 4-pound baby or 34-weeker, they probably be okay, after they get their 2-month shots. So normally we tell you at least try to get through your first set of shots. If you were in the NICU long enough that you went home and you already have shots, then you likely went home with the equipment too. So I would just kind of gauge that. So normally try to get through your first set of shots. And if it's in the winter, try to get through RSV or flu season. And usually by the summer, they're okay.
And Adriana, I think, I guess what I would imagine too is that every parent is going to feel differently about when they think their baby, even in the best of times, right? When their baby's ready to be around other people. I mean, there's a medical answer to it, but there's also just like sort of a family comfort level answer to that too. I don't know. Was that your experience?
Well, yeah, and I always err on the side of caution just because of what we had gone through. But on top of that, it is so instinctual as a mother, isn't it? I mean, I think if you're a parent, you can look at right? And you can look at your baby and think, okay, I know what this baby needs. And I would sometimes say to my husband even, she doesn't need any more food. And he'd say, but she needed it. No, just trust me. I know. It's an instinctual thing. You become so connected to your child. So I would say err on the side of caution. One, trust your instincts. Don't ever question yourself because what you feel in your heart is usually right. And then,
I agree.
Also the irony here is that I almost treated bringing my NICU babies home as if we were in a pandemic already, because I was social distancing for many months. I was making sure that everything was spick and span at the house. So in a way, it's like you almost as a NICU parent would be doing this anyway. Yes, there's one other thing that we're worrying about, which is COVID, but your baby's at risk for a number of things. So the fact that you're a NICU parent, you're almost more prepped for COVID in a sense.
Mm-hmm, mm-hmm.
And sometimes NICU moms, you have to say, okay, they're 5. It's okay. They can go to the party.
Mm-hmm. And I would add on to that, I love what Adriana just said, that, one thing that I really encourage NICU families to do is to really pause when there is a success, when your baby is not taking oxygen during all day long, maybe just at night or just during feeds. I think there's always this, but it could be, feeling for a lot of NICU families. And I would just really encourage people to just stop and feel that in your body that, oh my gosh, my baby's off oxygen for 2 hours a day. I mean, like that helps the success feel like your baby is less fragile and that you have to protect every single cell of that baby and you can release and let go. And I think that I really encourage a lot of families to do that.
That's so true. If I could just add on that too, you're so right. It was like the small victories were major in our house. It was like the littlest things like a poop or swallowing food on their own or latching to the nipple, whatever it was a huge victory for us. And also just to this day, I would want to let you guys know, my children are 3 and 5, both extremely healthy, thank the heavens. And but I hear my daughter, because she did go back for RSV to the hospital. When I hear either one of my children cough, it sends me into a tizzy immediately. So it's something that sticks with you forever. But again, you want to use your brain over the anxiety that builds up in you and use your instincts. That's like the greatest piece of advice I could get just as a mom. I mean, these women are experts and they know the best. So I so appreciate the knowledge that you've been sharing.
No, NICU moms are the best. NICU moms are the best experts on their child.
That is so true. I've talked to some NICU moms who sound like they've gone to med school. And
they have a degree. By the time they leave the NICU, they know everything.
They know everything. They got it down.
It really is like a Harvard education.
Yes,
parenting a newborn.
Yes.
Well, we certainly give a big shout out to all the NICU moms and dads and those that have graduates of the NICU. They are really. We talk about the babies themselves being little heroes, but the moms and the dads and the caregivers are the heroes as well. And we want to always shout out them for everything they do. especially in the midst of a pandemic. We had to give extra set of applause to all of those NICU parents. We are at the end of our webinar, and I just want to close out by saying thank you to all of you all. You guys have been amazing, and you've shared amazing information. And I hope we're able to answer a bunch of questions on Facebook, and we certainly answered some questions here. This is a really a challenging time for everyone, but I think it's really important to remember that for a pregnant mother, a new mom, a new dad, especially if you've had a baby in the NICU, especially if you're trying to bring a NICU baby home, I can't imagine anything more stressful and more challenging right now. So we really want to make sure that the March of Dimes, we're there for you with the information you need, the resources you need, any kind of follow-up support that you may need. We have a ton of information on our website at marchofdimes.org. We're able to do these kinds of things now because of the generous support of so many people. And frankly, some of our best supporters are families who've had their babies in the NICU. We're so grateful to them because I think they personally understand what our mission is all about and how important our work is to them. But if you're listening today and you do want to support our work at the March of Dimes, please don't hesitate to either go to our website and hit the donate button, or you can also text to give by texting MOD give to 51555, and you'll be directed to a donation page there as well. I want to mention a couple things before we go. We will not be having this particular webinar next week. Because next week is a very special week, because next week heads into Mother's Day, which is my favorite day of the year. And we are launching an amazing program starting next week. On Thursday, May 7th, so a week from today, we'll be hosting a special Mother's Day event. It's called It Starts with Mom. And Jessica Alba, who is well known, she's an actress. She's also the founder of the Honest Company, is going to be hosting our inaugural live It Starts with Mom event. We're going to have a series of different conversations and panelists and everyday moms and influencers and health experts, including Olympian Allison Felix, who is super special and super awesome as well. This event, which happens again next Thursday, there's a series of things happening, and on the screen you'll see the schedule. We're having a cool conversation on support. Moms at work and blessing the mom tribe and everything from 12:30 to 2 Eastern time. The next segment is around education. So conception and pregnancy in the time of COVID-19, really talking about what does it look like again to be trying to become pregnant or get pregnant, or if you're already pregnant, what does that look like? What do I need to really get to that place of having a mind, body, soul connection to reduce my anxiety and stress, especially during this pandemic. And then lastly, that day we'll be really talking about some issues around healthy moms, because without healthy moms, we have less of a shot at healthy babies. So we got to start with mom. And that's what this is all about. It starts with mom. So I want to thank you all again. I want to ask you all to join us next week. I think it's going to be a really cool thing. Go to itstartswithmom.org for more details. Also, you can go to marchofdimes.org for more details, but please tune in next week. And again, I want to thank all of the panelists today, Leanne, Adriana, Dr. Terry, Christina, for being amazing and for providing such great information and being such great friends and partners with all of us at the March of Dimes. So thank you all so much. You guys were awesome, and hope you have a great rest of your day.
Everybody,
Thank you.
Bye.
Take care.